Hello, I'm Megan. I'm going to be demonstrating a piggyback IV. First thing that I want to do for standard protocol is I want to be checking the physician's orders, which I have right here in my hand, making sure the patient has no allergies. He has ordered Rocephin 1 gram, which we're going to be administering via IV over 30 minutes. What we have available is 500 milligrams per milliliter. I'm going to check to make sure it is not expired, make sure that it is indeed 500 milligrams per milliliter. We calculate it to be 2 milliliters for this patient at a rate of 17 drops per minute. Some things about Rocephin. A safe dose is 1 to 2 grams once daily. It acts by binding to bacterial cell wall, causing the cell death. It is a cephalosporin, 3rd generation. It's treated for UTIs, skin infection, and respiratory infections. Side effects are GI upset and fever. It's contraindicated if you're allergic to penicillin or cephalosporins, and you cannot hang it with a calcium IV. It's also contraindicated for hepatic and renal disease patients, anaphylactic, and pregnant or breastfeeding patients. We want to assess the labs, in this case for liver and kidney function, so we're looking at AST and ALT, the BUN and creatinine. BUN we want to find at between 7 and 23, creatinine between 0.6 and 1.2. I've prepared a medication card, Rocephin. Here is the calculation for this patient. Okay, next I want to assemble the correct medication. So I have my my piggyback bag. All right, first I want to draw up the medication itself, the Rocephin 2 milliliters. So I'm going to be using a aseptic technique, getting alcohol swab, swabbing off the top, making sure that's clean. And I'm getting 2 milliliters of Rocephin. Drawing up 2 milliliters of air to inject. And drawing back 2 milliliters of Rocephin. Okay, I'm going to set this aside. And next I want to prepare the medication bag, so I'm going to be adding the medication. First I'm going to get the medication labeled, so I'm going to be putting what medication it is, my initials, the date and time that I'm doing it. I'm going to attach it to the bag there so everybody knows what it is. Once that's attached, I'm going to go ahead and add the Rocephin into there. And making sure that I use a clean alcohol prep to clean the port. And then I'm going to inject. I'm going to throw this in the sharps container, not recap it. And making sure that I mix the medication in the bag. Alright, I'm going to set this aside, and next I'm going to attach the needleless device. So I have my my sterile piggyback that I'm going to take out. Get that ready. Okay, once again, I'm going to prepare the bag, getting a clean alcohol swab, disconnecting the little blue cap, cleaning that, clean alcohol swab, cleaning this, taking off the cap and cleaning it again, and rubbing my fingers all over it, cleaning it one more time. Okay. going to set this over here for the time being, and I'm going to go ahead and make sure that, okay, it's going. So there's no air. Once there's no air, I've got that set to go. I'm going to clamp it and set it aside. All right, I want to make sure that I next label the tubing, letting everybody know that I'm the one that prepared it, the time and date that I prepared that. And then just prepping this. So I'm going to go ahead and hang that first and getting this ready to lower. Okay. I'm going to go ahead and wash my hands. Just going to wash my hands while I'm talking to the patient. And hello, Mrs. Smith, how are you today? Okay, just setting up your piggyback for you for the other medication that doctors ordered for you, which is Recepin for your infection. Did you have any questions about that? No? Did you have any allergies? Okay, very good. Well, we'll get you set up. And I just want to make sure that even though you're already hooked up to the IV, just want to make sure that you don't have any tenderness. Do you have any pain? No, no swelling, no redness, no infiltration. Okay. Next, I want to wash my hands again, and I'm going to put on some clean gloves. All right, once the clean gloves are on, I'm going to go ahead and get ready to set up the piggyback. And I need to lower the primary bag first. And go ahead and attach it to this port. Now, because the clamp is below the port that I'm going to be using, I don't need to clamp for the primary, but I do need to clean it using aseptic technique. I'm going to cleanse off the port again. Okay. And then making sure we figured it out to be 17 drops 17 drops per minute, so I'm going to put in the new drop factor for our piggyback. And then I'm going to go ahead and unclamp this and get that going. All right, once that's running, I'm just going to make sure that the patient is comfortable. I'm going to check the 4 Ps, pain, position, make sure the bed is down, make sure he doesn't need to potty, and making sure he has all of his possessions nearby. I'm going to let this infuse probably for about 30 to 45 minutes before it's out, and I will come back in and see that it's done. So I leave the room, wash my hands, get rid of gloves, leave the room. I come back 30 to 45 minutes, check to see how things are doing. I'm going to go ahead and wash my hands again. And just assessing, I don't see any redness, I don't see any infiltration, everything looks good. I noticed that the piggyback has, it's done running, so I can go ahead and disconnect that and rehook up the primary. So I need to put gloves on one more time. I've already washed my hands, putting clean but very small gloves on.
MJ.
And yes. So first I need to disconnect this, I believe. I'm going to clamp it down. Then disconnect. Setting that aside. And go ahead and take the old one down. And rehanging my primary. I need to make sure that I put in the primary drop factor as well, making sure that's up to date. I can dispose of this. Okay. So everything looks good. I still don't have any infiltration. I still don't have any infiltration or phlebitis. Everything looks good. If I had an alligator clamp, I would apply that, but we do not have one, so I won't be doing that. I've already reestablished the flow rate to make sure that the primary is back to where it's supposed to be. I'm going to clean up my area, make sure that all needles and sharps are disposed of properly, making sure all the trash and any kind of hazardous material is put away where it's supposed to be. Next, I'll go to the, I will take off my gloves, I will wash my hands, I will check the 4 Ps one more time, making sure the patient isn't in any pain, position is good, doesn't need to potty, and has all of his personal belongings. Then I will go to the MAR. I'm going to make sure that I record the date, the time, the drug that was administered, the rate of the infusion, the state of the condition of the site, making sure that to document that there was no phlebitis or infiltration, and also making sure that I record the volume of the piggyback fluid. Once all that's done, I am good to go.